Thank you for staying tuned and to Health Matters Now. Edo State government says there's no record of Indian COVID-19 variant in the state as being suggested in some reports. Governor Obaseki, represented by the Permanent Secretary, Ministry of Health, gave this information while briefing newsmen on the successes recorded in the war against the first and second wave of the virus in the state. Goodluck Inaini reports.
According to reports, the strain of the COVID-19 variant originated in India and was found detected in Edo and Osun states by the African Center of Excellence for Genomics of Infectious Diseases. The Permanent Secretary, while explaining the state readiness to any eventuality, called on the people of the state to comply with the proper use of face masks, hand-washing practices, among other preventive measures.
For those states, while noting some of these pandemic measures control, we are also doing so much, and we are also making our own state stand out amongst other states in the country to ensure that what is done here is most appropriate and is also giving us results, which can be evidence from what we are seeing in our control measures already put in place.
Experts project that if citizens continue to live their lives without compliance with stipulated guidelines, the third wave of the virus could present itself sooner than expected.
It's very important that we limit our movement, and if we have to move, let's keep social distance. It's very, very important, and above all, let's get vaccinated. It's very, very important because we need to take responsibility.
In Benin, Goodluck Inaini, NTA News.
Update, there are 41 new cases of COVID-19 infections in Nigeria. A breakdown indicates that Lagos has 16, Yobe 14, Rivers and the FCT 3 new cases each. Akwa Ibom and Bayelsa 2 and 1 in Edo. So far, 165,702 cases have been confirmed by the Nigeria Center for Disease Control. 156,412 patients have been treated successfully and discharged, while 2,066 deaths have been recorded. Meantime, Nigerians are reacting to the federal government's reintroduction of restrictions nationwide to consolidate on successes in the fight against COVID-19 and guard against the new wave of community transmission. Here are the views of some Benin residents. Even though government has since begun the rollout of COVID-19 vaccine, it has confirmed shortage in global supplies affected by the situation in India. This, it says, translates to delay in vaccinating a large proportion of its population and consequently risk of another spike, especially with low adherence to safety protocols. To guard against the renewed spike, government reintroduced curfew from 12 to 4 o'clock in the morning, mandatory temperature checks and no face mask, no entry policy in government institutions, as well as a reduction in any public gathering to 50, while bars, hotels and recreational centers are to remain closed. These Benin residents want Nigerians to take responsibility.
As government said, it's better to abide with the law because they know better.
But so many business people, they are going to have a negative effect of this. And most especially those who are business owners of recreational centers, their employers especially too, they are going to be affected.
They do the right thing. So they have to take it easy on people, understand?
They believe government has done well in containing the virus, but Nigerians must play their part to keep the nation healthy. And to speak more on reintroduction of COVID-19 restrictions and the new variant is the Director, Center for Disease Control, Edo State, Dr. Osa Bruce. Good afternoon. Thank you for joining us on Panorama.
Good afternoon. Thank you very much too. Thank you.
All right. For starters, can you quickly tell us the status now in the country? Is there a positive outlook in Edo against the new variant? I've just watched the PS, Permanent Secretary, Ministry of Health, talking about that earlier. Can you elaborate, please?
Yes, there's a new variant, the Indian variant. But if you really look at it, when we got the story that there is the variant in Osun and Edo State, we had to go and really investigate it. And from what we've seen, because the report was given to Nigerian Center for Disease Control, so we had to reach out to the Director General, Dr. Chikoye Kwazo, and the report he gave was that the variant that they saw in Osun and Edo State, the samples were sent to the centers in January. Because since the first wave, what Nigerian Center for Disease Control has done is to try and see that they build the capacity of some laboratory, the centers in the country to be able to do genomic sequencing. Because that genomic sequencing, you really know where the virus is coming from, the type of virus that it is. So 4 centers have been built to that capacity to do genomic sequencing in the country. And one of the centers is the one in Redeemer University that found out that the same variant that the India has, that we had it in January. And yeah, it even predicted the one in India, the one that is causing havoc in India. But the only thing that the Professor Christian Happy, who did the test, said was that it's the same variant, but the one in India has undergone some form of change, mutation.
Okay, mutations.
Yes.
Okay.
So that is it. So there is no cause for alarm because we had that same type of variant in the States in January because the test, the sample was sent to them in January. Because what they do in the country, they randomly send samples to these centers for genomic sequencing, and it was found out that the variant that is causing havoc in India now, we had it in January, and we did not have anything, no untoward effect. But what that one means is that the one that is causing havoc now in India has undergone some change, mutation. We should be strict with our policies to prevent it from coming from India to this place, because rarely people move and there are no restrictions. Persons can carry it from India or from any part of the world to this country. That is why Nigerian Center for Disease Control and the Presidential Task Force had to bring out restrictions so that prevention is always better than cure. We all see what is happening in India, and I know by grace of God, with all these measures that have been put in place in our country, it will not be transported or imported into our country.
Okay, what is the disposition of the people in Edo State towards the reintroduction of restrictions in terms of enforcement and compliance of these new restrictions?
Yes, just last week here, to precise, on Friday or Thursday, that the restriction, the governor, His Excellency Norias Obaseki, addressed a press conference, and the restrictions were brought out. And really, if you really look at it, Edo State are always very proactive, because even before the PTF brought out their restrictions, we've already laid down what we do, and in order to make sure that Edo State is free from not just COVID-19 alone, from other infectious diseases. And really, what we have to do, we have to enforce it and let the people know. People are already seeing it, what is happening in India. We know it will not come to this country by the grace of God, but we have to do our own bit. Our own bit is to make sure the restrictions that we've put in place, the NPI, that the non-pharmacological intervention that we put in place, people are there strictly with it. And when we do this, it will not come here.
Okay, how is the vaccination process going? The federal government has said, yes, second doses of vaccine people can start taking it now. Have you started in Edo?
No, that's the second dose of the first phase.
First phase, yeah.
Yes, we've not started because we are starting, we are still, that first dose, first phase, the first dose, we've not ended it. We are ending it this Friday because we saw that the interval between the two doses, at least 6 weeks. And from the dose that they brought to the state, we know that the expiring date is in July. So if we carry a little bit till Friday to accommodate many people, because our target population in this first phase, we've almost hit 90% of it. We are about 84, 85%. So when we have an additional 1 week, more people will be captured. So that's what we are doing. The first phase and the first dose will be ending this Friday. Then we will now start the second dose of the first phase.
Okay, what about the vaccination for teachers? What's surrounding that? Teachers must be vaccinated.
Yes, if you really look at it, on Friday when we were bringing out the technical committee for schools and not just schools alone, other places, when we brought out our own recommendation. You know, before this time, when the second wave started, the schools in the municipal, already Ikubaka and Igor, they were going to school in two phases. Some will go in the morning, some will go in the afternoon.
Morning section, afternoon section.
But this time around, because of the data that we were getting, the cases were coming down, people were more compliant to the interventions. We had to make sure, since the school just started for the third term, we said, okay, there should be one section just in the morning. And when they go in the morning, we know that majority, the persons that we are talking about in the schools, they meet with teachers. Yeah. And if the teachers are not vaccinated, you cannot know whether the teacher will not take the COVID-19 to the students. But if you look at it, the WHO rightly said that people that to be vaccinated 18 years and above. What about the people that are below 18 years? And if you look at it, if the teachers that meet with them regularly and they meet with persons from other teachers are also, how will I put it now, there are persons that meet with people regularly in the society, so they need to be vaccinated.
Any challenges from the vaccination of teachers?
Not really, because we rolled it out last week and it is going on smoothly.
Okay. All right. Thank you so much, Dr. Bruce Osa, Director, Center for Disease Control, Edo State. Thank you so much for your time on Panorama.
Thank you very much.
Moving on now, the Joint Admissions and Matriculations Board, JAMB, has extended registration of candidates for the 2021 Unified Tertiary Matriculation Examination and that of direct entry candidates for another 2 weeks. Registrar of JAMB, Professor Ishak Oloyede, stated this at the end of a 2-day stakeholders meeting in Abuja. Olayinka Ujo reports that the registration exercise will now end on May 29, 2021.
These stakeholders consist of representatives of the Federal Ministry of Education, the National Identity Management Commission, Federal Competition and Consumer Protection Commission, the National Office of Servicom, Nigerian Communications Commission, telecommunication companies, and digital service providers. And for 2 days, they deliberated following reports of widespread delay in the ongoing registration of candidates for the 2021 Unified Tertiary Matriculation Examination, as well as those for direct entry on the way forward.
Candidates' non-compliance with registration requirements, using wrong format to generate profile code while sending NIN to the board's USSD code 55019, using multiple cell phone numbers to generate profile code with the same NIN. CBT Center's violation of registration procedure is another one.
Some of the challenges that led to the extension for registration are presently being addressed, as some of the operators gave the assurance of the optimization of their services during the extension of the registration.
The 2021 mock UTME, earlier scheduled for 28th May, 2021, we now hold on the 3rd of June 2021. While the main UTME we hold from June 19 to July 3, 2021.
At the time of filing this report, a total of 1,134,424 candidates have so far registered. Olainka Ojo, NTA News.
You can get more news and updates on www.nta.ng or follow us on our Twitter handle at NTA News Now. You can also like us on Facebook at www.facebook.com/NTA Network News, and also stay connected and subscribe to our YouTube channel at www.youtube.com/NTA News Online. Also remember to watch our news live streaming at www.nta.ng/live.
And that ends Panorama from the Benin Network Center. Thank you for watching. NTA stands against rape and rapists. Be a part of the fight. I'm Agatha Egwari Ojo. Thank you again for being there with us. Do have a pleasant day. Good afternoon.